coordinator for our academic side of everything because we have academics, you've probably heard of continuing ed classes that we offer also. And I know y'all were talking about some people would like to get certified in first aid and CPR. We actually offer a CPR certification through our workforce development at MCC, and it's like $25, and you go like on a Friday for a few hours. So that's something you might want to consider if you wanted to do that. What I do is I teach a whole semester class. It's all semester. We cover all different types of areas, and I try to pick today some topics that y'all might see every day. Also, I've put some things in there that you might could use at home, like with infants and children, because I'm sure most of you have children, or you have grandchildren, or you're around children. So I did add some of that. I might not get to that today, but I did add that in the packet for your reference as well. So if we have time, I might go over that at some point. So that's a little bit about me. And the first thing I kind of wanted to talk about is the most important things, I'm sure, while you're here, to talk about the CPR part. And first, you kind of need to know when you would have to give CPR. So just always remember, which I've told my kids before, I call them my kids, my students, they can't, they're not going to be breathing when you give them CPR. A lot of them, they just think, okay, they're unconscious, I got to give them CPR. So make sure that you do a few things first. Of course, you'll check the scene, make sure it's safe for you, and then you're going to check the person. And what we say, and you can see in your packet as well, you'll see there where it talks about number 1 on page 1. It says giving CPR to an adult. You do need to kind of tap them on the shoulder and say, "Are you okay?" Just to make sure somebody's not sleeping. They could just be sleeping. And then you tap them on the shoulder, kind of wakes them up. So that would not be a reason for you to call 911 at that point. So you would tap them on the shoulder, say, "Are you okay?" And then if they don't respond, that's when you would say, "Somebody call 911," or you would call 911 right then. Because we say unresponsiveness is a reason to call 911. After that, you would then check for breathing. And the way you do that is you put your hand on the forehead, 2 fingers under the chin, and we call that head tilt chin lift, where you're going to lift the chin and you're going to put your face close to the mouth and you're going to check for breathing this way. You're going to put your, what we call that look, listen, and feel for no more than 10 seconds. And you're looking at the chest, making sure you can see if it rises and falls. You're also listening for breathing and feeling for their breath on your cheek. So that's the way that you can check for breathing. A lot of people say they're going to check the pulse in the wrist or the carotid artery, and we don't do that in our class because we're like the lay responders is what we are. I know Marcy said that she used to be a lifeguard, and they have a little bit more advanced training, so they would probably check. If you have more advanced training, they'd probably check the pulse. Do you remember if y'all did? At that training, they do check pulse. So if you've ever been a nurse or anything like that, you have a little bit more advanced training, yes, you could use that training to check the pulse. But us as lay responders, we might not ever come encounter with having to check somebody. So this is the easiest, most simple way is to look, listen, and feel for no more than 10 seconds to see if somebody's breathing. So as soon as we determine they're not breathing, then that's when we would start our CPR. Now, some of the reasons why we would do CPR is because somebody might be having a heart attack and become unconscious, and then they are no longer breathing. Now, just because somebody's having a heart attack, we are not going to give CPR right then because they're still breathing. A lot of people are just sitting there and they're having those chest pains. Of course, we would call 911. We're now going to watch just a short video about seeing signs and symptoms of a heart attack. So if you want to click on that one.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild to unbearable. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
So it is important to know those. My dad actually passed away 8 years ago because of a heart attack, and he didn't know the actual signs and symptoms. He just thought he had a stomach bug, and because he was vomiting a lot. And then his secretary, one day, he turned pale and just kind of weak, fatigued, and his secretary, knew something, of course, was wrong, because you could tell. And so she called 911 immediately, and thank goodness he was in town where the hospital, close to the hospital, and they got there, and they got him stable enough then to transfer him to another hospital. And to the second hospital is where I met, our whole family was there at the second one, and they were pretty much preparing us for the worst. And he ended up making it through and just got better every day. And then he stayed in the hospital for a while, and then he went back home on a Wednesday, and on Sunday he had another heart attack at home, and that's when he passed away. But you never know. I mean, he was 60 years old. He was a diabetic. He was not really overweight, but it did run in his family. And so that's things, I have to look out for. So, just think about that too, and just know those signs and symptoms. And knowing how to give CPR is one of the things that is very important too, because if somebody doesn't know what to do, a lot of people who die from heart attacks die within 2 hours after the first signs and symptoms of a heart attack. So it is important to know what to do if the person, of course, becomes unconscious. But know those signs and symptoms. I know sometimes people are stubborn and say, oh, well, I'll be okay, or don't want to realize that something's really going on. But you definitely need to seek help, because even if it is indigestion, at least, you had it looked at, because it can really affect you now and later, because they said he actually had some small heart attacks before he went into the hospital. So he was not, he was kind of stubborn about wanting to go. Like I said, he was diabetic, so we'll talk a little bit about that in just a few minutes. But I did want to go ahead now and talk about what to do in the case of CPR. I did bring a mannequin. It's very light, so if you've ever had CPR before, they used to be like huge and very heavy. So now they're really light and it's easy. If you ever wanted to come, I did bring some things if you wanted to practice after we finish today, just kind of get an idea, because I know I actually took this to my family and had them practice with them too. And my mom was so weak in her upper body that she couldn't even push this down far enough to even make it click. So, getting kind of an idea of what to do. So I told you the first part about how to check the steam and everything. So once you determine that they're not breathing, that's when you want to go ahead and start with the compressions. So it's very simple. You give 30 compressions and 2 rescue breaths. 30 compressions and 2 rescue breaths. So everybody interlace your fingers like this. Okay, the heel of your hand's going to go, that's what you're going to kind of push down. That's really what's pushing down in the center of the chest, is the heel of your hand right here. Your elbows will be stiff and straight. And then if I were a little bit taller, this would be appropriate, but you should have the person lying flat on the floor. So you're going to be keeping those fingers interlaced. They're going to be up off the chest, and it's going to be in the center of the chest, and then you're going to be pushing down, keeping your arms straight. That's probably been a good idea. It's kind of high. I wanted y'all to be able to see. But you can hear that click. you want to make sure that your shoulders are directly over. Your shoulders are directly over your wrist, okay? In this case, it's hard because the table's high, but you do want the mannequin to be on a flat surface, the person on a flat surface at all times, because if they're in a bed and this is happening, you do need to move them to the floor, to a hard surface, because as you do your compression, it's pushing down on the mattress and it's not really compressing the heart. So what the compression does is it pretty much keeps the blood circulating to the vital organs, is what it does. So the person might not wake up, but you are keeping that oxygenated blood going to the brain, because after about 2 minutes without oxygen, the person could be starting to become losing their cells in their brains are going to start to die. So they will start after 10 minutes. It's irreversible, and that's kind of what happened to my dad. Is because the ambulance didn't get there for like 15 minutes. So he had been without oxygen for that long, and he had no brain activity after he got to the hospital. So you want to make sure you keep that oxygenated blood going throughout the body. The actual rescue breaths that you give, those will help, of course, get the oxygen into the body, into that blood, into the lungs. So you're actually artificially breathing for the person. So once you do a compression, you press down, that might have to keep, pushes all the blood out of the heart. And then when you release and come up, all the blood goes back into the heart. The rate that you want to be doing your compression is about 100 to 120 per minute. Okay, so we're doing 30, but we're going at a faster rate than 1 every second. So normally the rate is 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14. That's how fast you want to do that. Now we're going to watch a video, and it's the CPR adult. Yep, that's it. Staying alive. They change it every few years. They kind of look at how to make it more simple and also scientific ways to teach CPR, and they've actually increased the number from 100. It used to be 100 beats per minute. Now they're saying between 100 and 120 compressions per minute. And yeah, I think it'll pop up after you click download. When you click download, did it something pop up saying?
Are you on Internet Explorer or Chrome? You may try copying your
Yeah, I think it might be.
copying over to Chrome.
So again, I'll just kind of go over a few things of this. So it's 30 chest compressions. You'll be 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 30. Then you will give your 2 rescue breaths. I do have what are called breathing barriers that we could use if you did want to practice. This is a mask that I bought on Amazon. It is only like $5 to $7, and it came with a little alcohol sterile wipe and some gloves. And then I put my own gloves and stuff in here too. But you can use your own mask if you want to, or you can use one of these little breathing barriers. This is what we use in our class. And you just put it over, and it even has a picture of where to pinch.
After confirming that someone is unresponsive
and pinch the nose, lift the chin. Just put your mouth over the mouth and give your 2 rescue breaths. So you have to put a tight seal over that mouth to give a rescue breath. Once you pinch the nose, make sure you're pinching those nostrils like you would if you were jumping in the pool for the first time. You didn't want water to get in there. And make sure you tilt that head back because that opens the airway. Just make sure you also watch the chest. because if the chest does not rise, then there could be something in the throat, and you might not know that until your breaths do not go in. If your breaths don't go in, then you can say, okay, you will start checking the mouth after compressions. But you won't look in the mouth, just normal CPR, only if you see that the chest is not rising. Some people might think, well, it's probably me because I didn't blow hard enough to raise the chest. That's the reason we get, one of the reasons we give two, so that if the first one doesn't go in, the second one does, then you know that you're doing okay. But if both of them do not go in, after you finish your next set of compressions, make sure you look in the mouth. If you don't stick your finger in there unless you see something. But after you look in the mouth, then you will give your next rescue breaths. If you see something after those compressions and you look in the mouth, go ahead and get it out. So that's if somebody, has what we call if they are choking, unresponsive and choking. And again, a lot of times you won't see that unless they are until you start giving those rescue breaths. Sometimes they might be choking and you're doing the back blows and abdominal thrusts while they're awake and they become unconscious. And then you have to make sure you're going to be giving CPR because they're not breathing at that point. All right, want to watch the
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass neutral position. Pinch the nose shut, take a normal breath and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
So that was just a little scenario to also put everything together that I kind of went over earlier. And it also told you how long to continue. So you see you continue until you can't go anymore pretty much. You're too exhausted. You see that they're starting to wake up or, EMS get there or we get the AED there. A lot of places now have an AED. Do y'all have one here? No. Y'all do not? I would recommend asking for one, investing in one, because you never know when you're going to have to use it. At MCC, I don't know if y'all know, we had an employee last year who had a heart attack on campus, and at that time we only had one on campus, one AED machine, and now we have 10 on campus because of that. So he did pass away, but it kind of said, okay, we need more than just one on campus. And it was in our fitness center where I'm located at. Now, I'm not going to actually go over right now the infant CPR. I do have the handouts for those. And if I have time at the end, I can go back to that because it is different than with the child and the adult. The child is almost the same exact as an adult. On page 7, you will see there, I did include this. It kind of shows you the differences in adult, child, and infant. So if you do want to, if you ever have to give to a child, it's almost the same exact as an adult, except you're not going to go down as far. With an adult, you go down at least 2 inches when you do your compressions, and then with a child, you go about 2 inches, which just means at about the 2 inch mark. An adult, you might want to go 2 inches or more, is what that means. And then with the infant, it is a lot of differences in that. So I did want to point that out. On page 8 are the special circumstances, and of course, there's always it's not always black and white. There are some gray areas sometimes. So I did mention if your breaths don't go in, what to do, and that's if they have a blocked airway. So that's that first part, and then shows you for the adult and child is that top picture. The second picture is for an infant, where you're going to use your pinky finger. If somebody's vomiting, it shows to roll over on their side and use your gloved hand to kind of help get that out. And then if you're unable to seal over their mouth, because they could have like a broken jaw and you just can't put your mouth over theirs, then you can actually put your mouth over their mouth and nose, or over their nose to do that. Now we're going to talk about the AED. I did not bring our sample, and I apologize. I thought about it this morning because I gotten everything yesterday when I left work, and I was thinking, man, I got the AED. But we are going to watch a video about it, and there's also these pictures here, and I'm going through to tell you what to do. Now, and I do want to tell you, as soon as the AED gets there, you use it. Even if you're on number 13 chest compression, you stop what you're doing, take their shirt off. You're going to wipe it dry. No alcohol, because electricity and alcohol do not mix well together. So we want to have it wiped dry, and then we're going to place the pads on the upper right and then lower left part of the chest on these areas here. Okay, upper right and then the lower left part of the chest. And if somebody, we talk about this in my class, and people say, well, what if they have a lot of hair on their chest? In the AED kit, it should have things like a razor, and also things to wipe dry. Those things should already be there, and scissors to cut people's clothes off if you need to. If somebody has a lot of hair in that area and you think that those pads might not stick, then you can just dry shave just that area. Of course, you don't have to do the whole chest. It's not going to take long just to get the razor and shave that area where the pads are going to be placed. So now we're going to watch the video about AED. Looks like it's loading up there. I did want to mention on the CPR part, a lot of people are like, well, I don't want to put my mouth on a stranger's mouth. There's actually what's called hands-only CPR, and you can do compressions. Like if you don't have one of these breathing barriers or masks, you can just do compressions, like at the rate that we talked about, 100 to 120 per minute. You can just do those until you're too tired to continue. Okay, so know that you can also do that if you want to. While we're waiting on that, the skill sheet. These are actually pages from our book, and this shows at the end of each chapter if we have a skill in that chapter. It has the instructions on how to do that at the end, and with the pictures. So you'll see there the AED machine is so easy. It's nothing like you see on TV in the ER where they say charge 200. You don't have to do any of that. You just turn it on. That's the first question. One of the questions actually on our quiz that I give my students. What's the first thing you do? And it's turning it on. And it will tell you connect electrodes, and then you plug in this little thing on the top. And some of them only have 2 buttons on it. Some of them have 3, but some of them only have 2 buttons. I have 2 different trainer ones. One of them has 1 button. One of them has 2 buttons, and one of them has 3 buttons. And one is an on-off button, one is an analyze button, and one is a shock button on the one that has 3. The one that has 2, one is the on button and one is the shock button because it analyzes itself. The only main things you do need to know is not to touch the person when it's analyzing, and not to touch the person when it's delivering a shock. If you're touching them while it's analyzing, then it's going to pick up your heart rate too, and it'll throw it off. If you're touching it when it delivers a shock, you know what's going to happen there. You're going to get shocked too. So that's the reason we say don't touch them at that, during those times. And of course, we don't want to be around water at all. We don't want it to be wet. So that's the reason I say to dry them off, if at all possible, as much as you can. Yeah, go ahead.
When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts. Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary. Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say, clear,
Clear.
in a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say, clear, in a loud, commanding voice. Push the shock button to deliver the shock. After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while Responder 2 sets up the AED. When the AED prompts analyzing heart rhythm, Responder 2 says, clear. Clear. Then the responders switch roles. Responder 1 will now operate the AED, and Responder 2 will now provide CPR. The responders should switch roles in this manner each time the AED analyzes the heart rhythm. Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are increased.
So they talked about the pediatric pads at the beginning. A lot of AEDs don't come with those. Some of them will. You have to probably request those because you can actually use the adult pads on a child. So that's when they're saying don't use the pediatric pads on anybody who's older than 8 or more than 55 pounds because they're not going to be as effective. But if that's all you have are the adult pads, use those on the infant or the child. Did everybody kind of understand how to use the AED? It's very simple. Some people are scared to use it, but I mean, it will actually, doing the CPR, getting that blood going to those organs until that AED gets there. AED is what's going to bring them back because it's going to correct the heart. So that's really what they need. That's why I was saying, if I've even looked at getting one personally for my home because I live about 15, 20 minutes away from the hospital. So, it'd take a while for them to get there. And then one person giving CPR that long is, they'll get tired after about 2 minutes of giving CPR. You can normally give about 2 rounds of CPR in 2 minutes, and, people start getting tired at that point. So if there's nobody else there, that might be it. That might be all you get. Then let's see, let's go to choking. And this, the skill sheets are on this as well for choking on page 11. This shows somebody who is conscious, and I heard you talking about, is it your child who is choking on a piece of fruit? You never know what's going to happen. The universal sign of choking is somebody doing this because they're not going to be able to, cough, they're not going to be able to cry, they're not going to be able to breathe or tell you what's going on. So you have to kind of look at them and see. If they can't talk to you, then you have to figure it out on your own what's going on. So a lot of people, there's different things they do. There's one time I was at an awards night and it was real quiet, and this was at MCC in the auditorium, and I heard the piece of candy being open, and I heard the little the kid go, I heard that noise, and all of a sudden I turned around, was about to step over the seats, and then his dad already had him over his lap and slapping on his back, and then you heard the piece of candy hit the floor. So it does work doing the back, what we call the back blows, but he might not have done it exactly, but hey, it worked. We recommend, you've probably heard of the Heimlich maneuver before. That's not really what we do with the American Red Cross, because that's only just doing the abdominal thrust. We actually do the back blows where you're going to hit their back first, and then you do the abdominal thrust. So we do 5 of those, and then 5 back blows, and then 5 abdominal thrusts. And you can see on there. And then also there's a video, should be a video about my students. I have them practice this on each other. Of course, I tell them you cannot actually hit anybody in the back, or push on their abdomen. If y'all want to stand up, I know y'all been sitting for a little bit. Stand up, and the person beside you, you can practice with them if you're comfortable with that. If not, you can choose somebody different. You can. Do we have enough? Now with this, even though he's taller than me, I can still do back blows and abdominal thrusts. So what we do? You don't have to participate. So you're going to stand beside them so that you can, of course, have good balance here. So you're going to be holding your neck. Now I'm going to place my arm underneath on his shoulder, bend him forward, put the heel of my hand between his shoulders. Now I'm going to give 5 back blows. I'm going to go 1, 2, 3, 4, 5. Now I'm going to lift him up. I'm going to go behind, find his belly button, go 2 fingers above, and I'm going to have my thumb toward his stomach, and then we'll go up 1, 2, 3, 4, 5, and then I'm going to keep doing this until he spits it out. Good. I'm glad I helped you out there. Or until he, of course, becomes unconscious, that we talked about before, and then I would continue with CPR, checking his mouth after compression. Thank y'all for standing. Some of you participated. Kind of wake you up a little bit. And I think it's going to work now, so it's going to kind of show you what I just demonstrated.
Is choking and obtaining consent. Give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach, right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts.
The infant is different, and again, I can show you that. And we consider infant 0 to 12 months. So anything over like a year old and into about 12 would be considered a child, and then over 12 would be considered an adult. So that's kind of how we do those, the different ages for the adult, child, and infant. I did put that in here for the infant choking. You would see that on page 13 and 14 of the handouts. Any questions so far about CPR, AED, and choking? I thought those are probably the most important things that y'all wanted to know or needed to know, especially in your work at home. These are great things to know all around. Yes, ma'am.
Is there anything that you can provide information on possible seizures? Is there any different CPR, or is basically the same?
No, actually, I just finished talking about seizures in my class. With seizures, there are a lot of people who have seizures normal, like they have them every day. They might have them twice a week. If they normally have them, you just have to move things out of the way and let them have their seizure, finish their seizure. Now, you would call 911, of course, if it's their first seizure. They've never had one before. Also, if it lasts for more than 5 minutes, or if they have another one, like if they stop having one and they have another one back to back. If they're pregnant, if they have diabetes, I'm trying to remember the whole list because there's a long list. If they're an infant or a child and have a febrile seizure because of high fever, which I don't know if any of y'all experienced that, but my nephew, that happened to him one time. He had high fever and then he had a febrile seizure. So they would need to seek medical attention for that. If it's a child who has a seizure, if it's somebody who is older and it could actually be associated with a stroke, then you would also call 911. So people who actually have seizures often, and they might take medication for it, or they know they have seizures, then you don't have to call 911 for them, unless they say, they don't feel well, but you would stay with them until they, were comfortable, felt better, just kind of, keep onlookers off, try to keep, as far as keeping them, they might be embarrassed about having it or whatever. But there's not really any first aid or CPR that you would do. Now, of course, if they injure themselves, they're bleeding, you would help them with the bleeding, or any bumps and bruises, you would get, like ice packs and things like that to help. But yeah, if it's their first one, they probably need to go and see why, why they're actually having those. So, because sometimes those are symptoms of other things. We go into detail about different types of seizures. Some you might hear people have epilepsy. A lot of times it's because of a neurological type of something going on, maybe from like somebody had a car wreck and then they start having seizures after that, or they said even the statistic in our book says 2/3 happen that way, and then like 2/3 happen they don't even have a reason. They don't even know the reason for epilepsy. So a lot of people can correct that with medication, but if it is that's scary if it's first time. But yeah, if it's normal for them, just move things out of the way and clear the area. I'm going to kind of go over a few other things. We have a few minutes left. Diabetes is the next section that I have. I told y'all that, I think I told you my dad was diabetic. So I'm just going to kind of point some things out here, because you might have people who come into the bank or that you're talking to who just aren't feeling well. A lot of people think these people might be under the influence of alcohol because they're stumbling, they're slurring. If they're having a diabetic emergency, and then they could have a fruity kind of scent, that you might think that they are under the influence. Or once I showed a video to my class, and there's this man who has his head on the table, and nobody wants to help him. Like, people walk by thinking that he's a homeless person, or a group of people point at him and say, that man's drunk. But then there's a girl who wants to go help, and then she looks at the medical ID bracelet and notices that he's diabetic. So things that you could do and look for, or try to see if somebody, the signs and symptoms. Let me see if that's in here. On page 17, those are the signs and symptoms. I'm not going to read those to you. And then how to help somebody who is having a diabetic emergency is also on that page. What you would do if they're awake, you would give them something with sugar. Even if they have high sugar at the time, the amount of sugar you give them is not going to hurt their sugar levels. You're going to give them between 15 to 20 grams of sugar, and you see there underneath that first bullet point on care for diabetic emergencies, you can give them fruit juice, milk, orange juice, something like that has sugar, and non-diet drinks that have real sugar in it. That's what they also need too. And I wanted to talk about that. And does anybody in here have, you don't have to tell me if you are, but if you know someone who does, raise your hand. So most of us do know somebody who's diabetic, or they might be diabetic yourself.
Are you talking about type 1 or type 2?
Either. Type 1, of course, if you don't know this already, people are born this way. Their pancreas just does not produce enough insulin. And then type 2 is, you can see here on page, I think I have it on page 15, right underneath the picture where it says type 2 is the most common type. 90 to 95% of people have type 2 diabetes who have diabetes. And what happens is that the body does not produce enough insulin to meet the body's needs, or the body becomes resistant to the insulin that it produces. So that's what happens, and then the person's sugar is too high. So I have to make sure that I exercise, I eat right, because again, it's hereditary, it runs in my family, so I have to be very careful with that. I do recommend not giving insulin shots. I tell my students, don't give them their medication of insulin shot unless you're already trained to do so. Like if it's your child, a parent or somebody that you know that you are already trained and know how to do. But if it's a stranger and they say, oh, I have my insulin right here, don't grab it for them and give them an injection, because you could give them they could go into insulin shock. But you can't give them sugar. It's okay. It's not going to affect them. And then I wanted to touch on stroke. Stroke is something you've probably heard about, the acronym FAST, F-A-S-T. I'm going to skip a few pages. You can look on 19 to see how to prevent a stroke. And then on 21, this is FAST. So think FAST for a stroke. The F stands for face. So look and see if the person's face is kind of drooping down on one side. Their arms, ask them to lift their arms. If one's kind of is weak and they can't hold it up, that's an indicator too. It might be affecting that side. S is for speech. Ask them to say a sentence, and if they can't say it correctly without slurring, that kind of is also an indication. And then time. T is for time. Make sure you write down what time it began, because that is very important. A lot of people can recover from a stroke, and they have to go through a lot of physical therapy. But as you know, that is blockage in the brain, and it does affect the brain. So they have to relearn a lot of stuff. How to move certain, like if it affects the right side, they have to learn how to use that right side again. So those are things to look for and to get help as soon as possible. So let's see. The last thing was bleeding, and everybody kind of knows how to do that. So there's only one little sheet on it. So if somebody falls here or at home, just make sure you apply pressure. If it's severe bleeding, stop that bleeding. You might have to hold it there for 5 minutes. Ever how long it takes to stop that bleeding. Get a gauze, get something, and just hold it there over it for as long as it takes. And then you can get some roller bandages and then start rolling up and down, and then keep it on there. If it's going to bleed through that bandage that you put on, just apply more. Don't take that off. Just apply more bandages on top. If it's just a minor cut, we know we clean it. We put Neosporin on it. So it doesn't get infected. We don't do that for severe bleeding, because you just want to stop the bleeding. You don't clean that. You just put that pressure on it, apply pressure, and a pressure bandage, because they're probably going to need stitches or something, so they probably need to go to the hospital for that, or doctor's office if you didn't want to sit in the ER. But that's all the information I have, and it's about 11:45. Did y'all have any other questions for me? Did anybody want to practice with the mannequin or look at the infant?
I would do it.